All right, I'm here with Dr. Truc Nguyen, Integrative Regenerative Functional Medicine Doctor. We're here in Alpharetta, Georgia. I'd love to talk to you about functional medicine. This is an area I'm very much interested in. I believe in getting to the root cause of problems. I've dealt with, some chronic gut issues for years. I think a lot of people could benefit from knowing and understanding that, first of all, that this is an available practice for them to discover, what's actually going on with their chronic conditions and getting to the bottom of it instead of just throwing drugs at it, meeting a doctor for 5 minutes, and then here's a pill. As I understand it, with functional medicine, you meet someone for like 75 minutes, go over their history, and then run a bunch of tests and get to the root causes. Did I get it? Is that pretty accurate?
Pretty good, yes.
What else can you tell us about it in general? Like, what is functional medicine?
Yeah, so in general, you gotta get the background of medicine first before you could go into functional medicine, at least for me. In the allopathic medicine that we know today, it's a system, right? And it came from actually a Flexner report that Rockefeller Foundation, actually, they had a project and where they were looking at, well, how can I reuse these petroleum waste products that they were having? And at this point, he was already having a monopoly in the oil industry. But of course, I think, in the system that he was looking at, he said, okay, well, let's standardize medicine. And at the time, the US, before, I would say, if you put a time on it, after World War II was when there was a lot of movements from marketing, from poultry, the meat industry, the food industry, along with what Rockefeller Foundation was doing was that let's standardize medicine. So they go in and they say, okay, for you to be a licensed practitioner, you have to go to these medical school, and then they go to these universities and they say, hey, if you follow our system, you can be accredited. So they started creating the medical healthcare system, and then all of the holistic healthcare that was there at the time, because the US, there was no regulation before, but pretty much they said, well, now everything else like naturopathic medicine, homeopathic medicine, well, you guys are not standardized because you guys are not from a university, it's not accredited. But that was the birth of the allopathic medicine that we know of today. And it's born out of what they were trying to do was, what can I do with these waste products from petroleum waste products that could be made into medication? So he started pushing a lot of research into pharmaceuticals. So that was all the pharmaceuticals startup at the time was really started because of the Rockefeller's Foundation. I think understanding that allows us to understand why is the healthcare system we have today the way it is. So in that system is, let me find you, you tell me what you're dealing with. Let me group that set of symptoms and label it. Now we have a diagnostic system. Now there's going to be codes. So at the time, there was no insurance codes and stuff like that. But as we develop insurance, now we have to have a way to label all of these conditions that we're dealing with and give it a name and give it a code so that we can bill them. So everything in our allopathic medicine system is really to label people and find a pharmaceutical solution for that diagnosis. And as time passes, we add more diagnosis to these books that they created. And so that's really where we have allopathic medicine. And then
it sounds like a big business.
It really is. And as a doctor, I wanted to be a doctor since I was 10. And to go into medicine, went through med school, and I was like, oh crap, this is not what I wanted. I was witnessing people getting sicker. The 3 years I was in residency training, I saw every one of my patients got on more medications, got sicker, their labs declined, they felt worse. And so I was like, how is this? I'm a doctor. I'm getting people worse. I'm not healing. I'm not reversing anything. So that was when I was like, okay, something's wrong here. And when you're kind of in the system, you don't know that this is how the system works.
Yeah.
You can only see something's not right. But at the time, I just didn't know. Luckily, I had a patient who who was diagnosed with cancer. And she asked me a very simple question. What do I eat, Dr. Truc? How should I, take care of myself now that I have this diagnosis? And I thought, oh, just eat a lot of vegetables. That sounds good. I know sugar is bad. So I was like, okay, don't do too much sugar, focus more. But I knew in that when I was answering her, I was like, I should know more than this. I should be able to answer her with more certainty and should be able to give her a nutrition plan, because that should be part of her treatment plan.
Yeah.
But I wasn't. And that was when I started looking, okay, let me come up with a plan for you. So I did my research, and lo and behold, I found functional nutrition, how to use nutrition, food as medicine. And
That's
then I found
Aristotle, right? Food is medicine.
So these are very simple ideas that wasn't really taught in medical school. I had 3 classes on nutrition, and was really learning macronutrients and like calories.
That's
and
what I
all
hear.
of that
They
is outdated.
barely get any nutritional training in medical school. So all this was happening while you were in residency?
Medical school and residency, yeah.
Wow.
But yeah, residency was really when I discovered what I was doing was hurting people. And I was just not okay with that. I actually was going to go back to school and go do something else, because I was like, this is not what I wanted to do. But when I found functional medicine, I was like, this is it. This is how you can get people better. And at the time, this was about 10 years ago, it was just starting to come out, like functional medicine was just starting to take place, and you could find things online. And I was like, okay, and then I actually, raised money to go into functional medicine training. And that's when I trained with the Institute for Functional Medicine. And this, like, the more you learn, the more you practice, you start to really figure out the system. And that was when I started to see, okay, this system works for emergency medicine. I mean, allopathic medicine, like, that's where you want to go. Surgery, accident, that's what you want to do. But unfortunately, most of us are dealing with chronic issues, things that come up slowly, and allopathic medicine just doesn't have anything in their toolbox to deal with what we deal with on, day to day. And I was trained a family medicine doctor, so I see the whole family and I want to be able to take care of them. And so that was the transition into functional medicine, and that's why I integrate what I've learned in my training with traditional medical school and training, along with all the things that functional medicine has to offer, which is really looking at root causes. But it's a lot more complex than that, It's not just like, oh yeah, this is like one root cause that caused your symptoms. What I find and learn is that there's usually a collection of things that have been building up, and then meeting your genetic makeup, that combination produce epigenetic expression, which is where your body turns on certain genes that cause inflammation, which is actually a healthy response. But when that inflammatory response go unchecked, and it goes and it's chronic, it doesn't resolve, that's when we start having health issues. And that's pretty much what I want to share with people, is that you got to start understanding where the diseases are coming from, and the framework at least to look at what root causes are. And I can tell you the main 3 pillars that I see causes human diseases is going to be your toxic burden. Toxic burden is all the hidden infections you've been exposed to, all of the previous infections you've been exposed to, all the treatments. So a lot of the allopathic treatments like antibiotics, steroids, they leave long-lasting harm to the system, but we don't think about it. Like when you were little, you had strep throat. Okay, antibiotics. Oh yeah, you have another strep throat. Oh, another antibiotic.
I got ear infection when I was a baby, and then antibiotics, and then acne as a teenager, antibiotics. And now my gut microbiome's all messed up.
Yep.
Antibiotics for that.
Exactly, right?
It's a vicious cycle.
It is a vicious cycle. And so if we start to understand, and we got to educate people, like you got to be really discern, like, do you really need antibiotics? Most of the antibiotics that are given in this country are inappropriately given. Like even in medical school, they teach us, or they taught me, that we overprescribe antibiotics, and we're having antibiotic resistance problem, and there's a lot of health issues we're seeing, but they didn't draw the conclusion that it was the microbiome. Now we're starting to see a lot more research, And what I see is, in allopathic training, they stress the importance of evidence-based medicine. And this is where I was like, okay, great, everything is evidence-based, but there's a lot of research that we're paid, for, and you gotta really read the research, not like, oh yeah, there's an article about the research, and
Right.
we're like, oh
Not
yeah.
Pfizer's interpretation of the data, the actual data.
You gotta really learn, and obviously not a lot of people would go through and do that, but that's why I think the time that we live in nowadays is such a powerful time era. It's like there's a lot of knowledge being passed around because we have access to, social media, and people are speaking up from experience. And this is where I find it's important to understand, like, yes, there's evidence-based medicine, but also understand that there's a lot of made up data that are, paid for, or people just wanting, like scientists and doctors who work on projects their whole life, and then they come to a conclusion that's like throws off their whole life's work. They're going to change some data. There's a lot of people who change data just because it didn't come out the way that they expected, and they had spent too much time on it. So most of the data we have are skewed. Mm-hmm. And then we don't really use anecdotal data anymore. Yep. And it, in training, they teach you, use patient preference, use the anecdotal data along with evidence-based, right? But in allopathic medicine, when you're in practice, it's not like that. It's literally like, here's a guideline. You meet these numbers, these guidelines, put them on this medication. Mm-hmm. So what is my training for? What is my ability to learn and discern and be able to, talk to patient? Where's that? That was where I was like, okay, my training is useless if I'm just following a guideline, but these guidelines are population medicine. It's not you, right? So if I'm talking to you and you tell me I have to use this guideline and put you on a statin for your little bit like elevated cholesterol, that doesn't make sense. But because I'm in the system, I was actually forced to follow the guideline, and that was when I was like, I can't do it because I saw harm. And as doctors, that was our first thing, is that do no harm with everything that we do, and then making sure patients are informed. And I also think that was also stressed in medical training, but it's not used in real life that very much. And that what I mean by that is vaccination. Yeah. We don't truly have informed consent in vaccination. And these medication, I find that unless the doctor really go through and have an hour to sit with you and go over all of the side effect of a medication, then you're really not doing informed consent. Everything else is like, most of my patients, they have to advocate for themselves. They have to research, and then when they come to me, I'm their last resort because they've tried specialists and doctors. And so there's a lot of breakdowns in our healthcare system. Knowing that where the pros and cons are, what works in our healthcare system, will empower us. So that's why I want to talk to you. I want to educate people on how to advocate for yourself when it comes to your health, and how to discern what healthcare system would work best for you when you are dealing with something.
Yeah, this is amazing. So someone who's watching this, who's maybe used to the traditional route of going to an allopathic doctor who's just going to, go through the system and give them a pill, what does it look like for them? Let's say, okay, they're going to find a functional medicine doctor, right? Say, this sounds good, this makes sense to me. I'm going to look up a doctor in my area, and they book an appointment.
Yes.
And then what happens?
Well, it's kind of, so the functional medicine world is very broad right now. You have what you call like nurses, pharmacists, chiropractors, they're all functional medicine practitioner. So it really depends on your philosophy in like what kind of field are you believe in. Some people, they're like, I don't believe in chiropractic medicine. Obviously, then you have to choose the practitioner that leans towards more of your belief, so that your belief and philosophy align with the practitioner. So in general, I think if you have very complex cases, you definitely want to work with a medical doctor who is a functional medicine practitioner. if you're dealing with more like structural issues, like spinal issues, then I would find a functional practitioner who is a chiropractor, or who's even a DO, right? A DO could also do physical manipulation. But in general, if you want like comprehensive care, I find that, you know, medical doctors or even naturopathic doctors who are functional medicine practitioners, they're gonna have a broader scope of practice. Now, if you're someone who's like, okay, I'm dealing with gut and I have poor diet, then someone who is a nutritionist, who is a functional medicine practitioner, would be enough to support you. So it really varies depending on what symptoms, what condition you're dealing with. But I would say simple, like gut stuff that's newer, that you know for sure is more lifestyle and nutritionally related, I think anyone could support you with that. Because, you know, someone who could change your diet, lifestyle, put you on a few probiotics, understanding those principles, they'll be able to help you. But if you have medical diagnosis, insulin resistance, like deeper issues, I think you need to work with someone who can order labs, who can look at hormones, who can look at the whole picture and be able to manage everything. Otherwise, you're going to have one practitioner here, and you're going to have someone else to manage other component of your care. And I try to really create a care team for myself, right? So I have multiple people that I work with for different conditions. So I don't think there's like one person that will be able to do everything. And even if you work with me, I would still have to, you know, have different people on your care team for different conditions that you're dealing with.
Okay.
Yeah.
Okay, so what type of person is the most likely, like what do you see the biggest issues when people come in to see you? Like what's the most common symptoms or conditions?
Yeah. So for women, it's going to be fatigue, weight gain, brain fog.
Okay.
And then in general, anxiety, depression. But anxiety and depression is misdiagnosed. You could say misdiagnosed, misnamed even as a brain disease, but it's not. It's actually a gut disease. So anxiety, depression, mood disorders, and things like that. And then for my population, it's autoimmune disease and really complex gut issues. Like people who have gut issues and they treat it and it comes back or it doesn't really truly go away, those are more complex. But yeah, gut issues, huge. It's probably the most common is the bloating, constipation, or some form of bowel movement issues, and then reflux. I'm hesitating because there's so much more to gut issues.
Sure.
But those are basically the common ones that you will see a lot of.
And you mentioned that anxiety and depression is not so much a brain thing, it's a gut thing. Is that because the neurotransmitters are produced in the gut?
Yeah. Well, the neurotransmitters is one piece, but our gut has its own enteric nervous system. So it's called the enteric nervous system. Our brain is the central nervous system, and our gut is actually connected to the brain via the vagus nerve, cranial nerve 10. And you know, we hear about the vagus nerve a lot, but the connection is that when the enteric nervous system detects that there is inflammation, you know, invasion from overgrowth of bacteria, yeast, parasite, it knows. We don't know up here, right? But our enteric nervous system knows. It sends the signal via the vagus nerve up into the central nervous system. And then the central nervous system receives the signal and says, oh my gosh, there is inflammation here. And it manifests as worry, anxiety, and things like that. And even low mood is because of what's going on in the gut. And it's just manifesting like up here. And then, but historically, we've treated as if it's a brain disease, but it's not. That's why when you treat with SSRIs, like, you know, like different medication, sometimes it works, sometimes it doesn't. That's because we're not really targeting the root cause. We're targeting kind of like the end result. And so sometimes it may work if it hits the person
like
at
the
the right
Band-Aid
spot.
approach.
Exactly. That's why if you treat the gut, most of the symptoms resolve on its own.
And I heard that, you know, if someone has something like SIBO, small intestinal bacterial overgrowth, can lead to leaky gut, and then which is increased intestinal permeability.
Yes.
So you have partially digested protein peptides that
Yep.
migrate out of the digestive tract into the rest of your system. So maybe that could be causing some of the brain fog, anxiety in the brain if
That, yes,
it's having an
exactly.
autoimmune response to a foreign invader.
Yes, all of that. Yes.
Dr.
You're on the
Scholl
right
here.
track, yeah. Yeah, pretty much that is the root mechanism for 90 to 95% of all the chronic diseases that we deal with, including insulin resistance, including diabetes, high blood pressure, cancer. Pretty much all the major diagnoses that we see every day can be linked down to the gut intestinal permeability being compromised. There's a lot of, our immune system is pretty amazing. It can recognize things that doesn't belong in our system, but it can only do that to a certain specificity, meaning that it's very sensitive and able to pick up things, but for it to be very specific is not that great. So our immune system has limitation. Where the limitation is that there's certain food, let's say cabbage. It's known as a goiteroid food.
I thought you were going to say goy slop.
I don't know what that is.
That's a term the kids are using nowadays for bad food.
Oh, but yeah, so it's known to cause some goiters in your thyroid. And the reason for that is that there are structures in protein and food and our own tissue that molecularly, they are very similar, right? So everything is made out of carbon, nitrogen, oxygen, right? Mostly carbon. So carbon is the backbone, but imagine all living organisms are made out of carbon. So we have a lot of similar structures. And when your gut is leaky, there's a food that leaks in that looks benign, but it looks just like my thyroid. And now your immune system picks that up and say, okay, you look like a foreign invader, but you shape like thyroid. Guess what? It memorized that this is a foreign invader. And if you have more of it, it's going to start to cause a molecular mimicry reaction, which is where your immune system mistakenly think your thyroid is this foreign invader that your immune system had memorized. And that's how autoimmune disease develop, is this cross reaction between two very different molecules, but because they shape like each other, your immune system think that they're the same.
Wow.
And that's where our limitations of our immune system, as great as it is, causes the side effects of autoimmunity, because it's now overreacting to tissue or things that aren't really harmful.
And you mentioned the common effects for women coming in. What about men? Is it the same? Is it a lot of gut stuff, anxiety, depression, or are there
So
other things?
men, a lot of anxiety and depression, and a lot of gut issues and low testosterone, like low motivation, difficulty gaining muscle, and just like feeling like inflamed, like swelling, just not feeling well. But those are the most common things that men deal with. Women are a lot more complex, but in general, and men don't even deal with autoimmune disease that much, but I'm starting to see more men dealing with autoimmune disease, and it's because of the whole pandemic. There's a lot going on there that have put us as a population at risk now for inflammatory conditions, blood clotting, right? So there's two types of inflammation, simply put, is that one is that your immune system is overreacting and it treats everything as a foreign invader. Once you get to a point where you have a lot of infection or like your high toxic burden, your body will start to behave that way. The other is that your body thinks that you're in so much danger, it starts to clot at the same time. And that's the danger with COVID and the vaccine. But that's pretty much what we're dealing with. Yeah. Is that now there's a lot of people with clotting disorders.
Right.
So our risk of strokes, heart disease, all are increasing. We're now seeing younger kids getting pancreatic cancer, which is never seen in kids before until the pandemic. And now we're seeing more of that and more younger people. So generation, I think like millennials and younger, we're dealing with a whole new set of diseases that are, parents, grandparents have never seen before, because it's all environmental now, right? Because of, just since World War II, I mentioned earlier, during World War II, there was a lot of money and research that put into bioweapons. Once the war was over, guess what? All of those industries try to figure out, what am I going to do with all of these chemicals and research that now are useless? That's when we started to have pesticide, insecticide, was from all the research that was done during World War I and World War II, that time era. And then we started to put it into our food. We started introducing, we can use this to, increase yield. Of course, they have a lot of campaigns that have people believe that these are useful. And at the time, we weren't even here. So, we didn't have problems. So they're like, yeah, this is great. It increases yield for farmers. Everyone loved it until now, 50, 60 years later, we're starting to see the effect of these chemicals that we're now putting in the environment. And then during the same time, especially World War II, there was a campaign on poultry. So, at this time, the America in general was going through the Industrial Revolution, right? That age. So a lot of technology was developed. And so they were trying to see, like, what can we do with these technology? How can we improve lives and, all of the agriculture? So what we did was we started raising chicken in, like, big confinement, like chicken houses, like, like, what do you call it? Commercial livestocks, right? And this is when they started feeding these livestock food that historically they don't eat.
Bunch of
grain, soy, and all of these things are sprayed with a lot of chemicals. So all of that. And then during World War II, they said, hey, send your chicken in, send it to the soldiers, because there was a time where they were trying to get people to donate food and stuff. So they were asking for chicken. So Americans were like, well, that must mean that chickens are really good. So it kind of started a trend for us or the general American to believe that I should eat more chicken, I should eat more protein. And that was the whole campaign that they started with eating high protein. So historically, we actually only ate eggs from these chicken, but that was the period where we transitioned to eating more meat. And then there's the beef industry. They started going in and they start to, they're not saying like, what I'm trying to say is they push eat more protein so they can sell more meat. But inside of that, they're like, well, what about plant-based protein? Right? What is the important? Like, can we use plant-based protein? They're like, no, because plant-based protein is missing certain amino acids. And so they're saying that plant-based protein is inferior to animal-based protein. And that was really what set off the whole thing with our country, how we shifted from eating more plant-based and very moderate amount of protein to now very high amount of protein. If you look at the data and the research, people who ate more animal protein has higher rate of diabetes. They die younger. They actually impact their longevity and their overall health just from the type of protein they eat. But let's look at all of the marketing and all the things that you see right now. What is it pushing? Protein.
Seems like it's turning around now. They're pushing the plant-based proteins and like fake manufactured in a lab proteins.
Yes, that's even crazier.
Yeah.
But yeah, so now, right, they're trying to say, okay, well, let's be more plant-based, and they come up with cultured meat products that come from bacteria and fungus. I definitely recommend against all of the genetically modified food. Now, we don't have data to really tell us like what does it really do, but I think just use common sense. I think we really need to start using just critical thinking and think about like what nature makes available for us and what humans are making. Right. I think humans, we tend to be more profit centered. So everything we create is really for profit versus what's really available for us. And I think, what I try to tell my patient is that you got to embrace learning about health and what nurture you and your body on your own.
Yep.
You know, I can be a guide and I love to do that and I can educate, but at the end of the day, we have too much noise around us for us to really know what's true and what's not true. So you actually have to advocate for yourself and your family, and like you got to learn this on your own so that you understand the basic of what it is to give your body the health that you want versus following trends, right? And I think it's so dangerous now that there's so many people that have trust that a lot of people follow that are putting out there like GLP-1s, use all of these fad diet and things like that. I think it's very harmful to the people who actually just genuinely trust these people. And I think marketing is now really using people, influencers, in a way where we haven't seen in history of humanity. And so we got to be able to discern. I think the discernment, the ability to discern information is very critical in the time era that we live in nowadays.
Yeah, that's what I always say. You know, take personal responsibility for your own health.
Yes.
Don't trust the system; it's all corrupt, and just learn as much as you can, and get the healthy food. Make it yourself.
Yeah,
You know?
yeah. That's another thing. We're so disconnected from our food source. We don't like kids. They don't even touch food when they prepare food anymore, right? So I think the convenience. I think the price that we have paid for convenience in the past 50 years have cost us our real health. And now we gotta, like you said, take personal responsibility and educate yourself so that you can go back to really the roots. It's gonna go back to like how our ancestors were. But I think also being realistic is that it's not our ancestors' time anymore. So you got to be able to discern, being able to just simply read ingredients and understand what's in your food and finding out like which company is trustworthy, because where our money goes, that's what's going to feed the system. And I think personal responsibility is so critical for us to reverse and put power into the consumers versus the industry, like the corporations that are now putting out massive amount of, information and I think fake data. And I think there's a lot of censorship now that doesn't allow for people to really find the information that we once used to, like health data and health information. Even when you do Google searches, you will not be able to find what you need until like page 10. 11. So knowing how to do research as well, don't just look at what you first see, because everything we first see is fabricated.
Sure.
It's
You have
designed.
billion-dollar companies that can pay for PR and studies to say whatever they want. So yeah, you really have to.
You have to.
Exercise some discernment.
Discernment. That's really, I really hope people really take that on, because I just came back from two conferences. One was the American Academy of Environmental Medicine for adults. And before that, I went to one for children, like pediatric conference for special needs children. And what we looked at was autism, all of the neural inflammation condition that children are dealing with. And then I go to the one for the adults, and it's the same pattern. It's the same root causes. It's environmental toxins, heavy metals, EMF. The phone exposure is what the young alpha gen is dealing with. I think the parents, we need to really, I'm not saying like just 2 hours a day. I'm saying like you really need to put a lock on devices and remove electronics away from our kids, because they are getting sick, not just from environmental toxins and hidden infections, it's the EMF. And I don't care what, I used to be like, well, I don't know, because there's not a lot of data. But if you really look at the right data, not what people are putting out for, the general, what we're seeing, you will find it.
And you mentioned environmental toxins, heavy metals, vaccines. When you talk to someone who's maybe not in the know about this sort of thing, maybe they call it a normie or an NPC, right? Do they think you're a conspiracy theorist or you're just gone crazy or what?
I have been very careful to stay neutral because I believe, as a doctor, I need to be able to get both sides. But the more I practice, the more I learn, I cannot stay neutral. I have a lot of fear too. I mean, I have colleagues, and going into functional medicine, people literally warned me, stay low key. Don't speak out too much because they'll come after you. And I didn't get it. This was 9 years ago when I first started my practice. But now I start to understand, it's like, if you really go into this field and you know what you know, you can't.
Yeah.
You can't stay neutral, and you gotta speak the truth. Otherwise, people won't know, and I feel responsible. And once I feel like doctors who learn what really causes diseases and what's out there, it's hard because we have family, we have a career we want to protect, but at the same time, I don't want to give people the wrong information. At least this information is after years of me learning and researching and keep looking to see if there's anything I can disprove that vaccines, environmental toxins, and hidden infections don't cause these diseases. I was looking for that and I couldn't find anything to disprove. All I can find is more proof. And so I actually had to have a conversation with my family because I said, I can't not speak the truth. It takes a lot for me to start doing interviews like this because I do want to stay low key. I want to just be a doctor. I just want to help people get better. But I also see that if I don't speak up, people won't know. And I know there's a lot of people that do it, but I need to be part of that voice too because I'm responsible for my patients.
Yeah.
Yeah. So it's a lot.
It is. And we saw what happened to people that spoke out during COVID and potentially losing their licenses. And now we know a lot of the things they're saying there's absolute truth. I mean, we knew it back then, but some people didn't. And yeah, it just goes to show the apparatus, the system, this machine that's in place to maximize profits for these big companies and, certain individuals. Yeah, so, well, much respect for you for doing this and speaking out and trying to help people. It is risky. Yeah. So let's say maybe we can go through a sort of an example of what it would look like. Maybe take me for an example. Let's say I come in with the gut issues, the abdominal distension, fatigue, acne, sometimes trouble with energy and focus. And what would you do first?
So what I would do is the 75-minute call that I have with you is for me to comb through all of your medical history. So I trace back from your birth history, pretty much look at what's going on with your mother, right? What medication was she taking?
Don't get me started on my mother. Just kidding.
Yeah. And then really looking at what was your birth history like? Were you on antibiotics? What was your childhood history like? With the case of small intestinal bacterial overgrowth, the history of antibiotic use is huge. What makes it complicated is the SIFO, which is small intestinal fungal overgrowth, which about 40 to 50% of the time go hand in hand with SIBO. And when you just treat SIBO, you don't treat the fungal component, you will get temporary, better, probably a few months. But the moment you start eating, normal food, if you go off of your anti-inflammatory diet, all your symptoms will come back. So that's actually how you know if you have truly treated what was going on in the gut first. To further complicate that, there's also parasites. And so parasites, we all have parasites. It's a matter of what is your parasitic load. Most of us can deal with parasites, and we have no problem. The thing is, when you have bacteria and fungus and then environmental toxins, now your body's like, I'm dealing with so many things, I can't deal with all of it. and then that's when you start to have shutdown. And the other thing is, these organisms, they take up resources. They're going to steal your nutrients. So the brain fog, the fatigue is actually a cellular dysfunction that is manifesting as brain fog and fatigue, because your cells no longer have the ability to produce enough ATP at the cellular level. And so at the cellular level, if you don't fix that, your brain fog and fatigue is going to persist. So you can treat gut issues, and sometimes the brain fog and fatigue persists is because at the cellular level, you haven't done the work to repair the cells, right? So when you treat, so in your case, so I look through your history, and I also look for history of food poisoning episode. That's one that most people don't think about, but you could have had that in college. One episode.
Yeah. I was visiting my girlfriend at the time, her family, right? We're out of state for a wedding, and we're about to leave to go back, and all of a sudden it just hits me, and I'm out the whole night.
Yep.
Both ends coming out.
Yep.
And like every 20 minutes or something, it was horrible. Felt like I was dying.
Yep. So you got better, right?
Well,
but
we hope.
Right, but that's the thing. All those acute symptoms, those are what you experience, is acute infection. And then you think it went away when all my symptoms are gone, I'm good. That is where your microbiome have been disrupted. And most of the time, that organism, whatever you picked up, is viruses, could be a bacteria. Most of the time, our immune system will be able to neutralize them. That's why we feel better after a couple of days. But some people, these organisms, they stay in the gut at very low level, but they're just hanging out. They colonize, but at very low level, they sit around and they wait. They wait for opportunities for your immune system to go down. So pretty much another food poisoning episode or a stressful time, like testing, divorces, taking care of family members, anything that is a major stressor to you will trigger that organism to be able to bounce back, and they come back alive, basically.
So they're just lying dormant there, waiting for their opportunity to strike when you're
Most
weak.
Everything in our system that have like viruses, parasites, they all do that. And so when a case like yours, so then I would assess to see like, well, you had the one episode, right? Your antibiotic history, and then surgery. So a lot of women have abdominal surgery, childbirth or whatever, but all the adhesions from the surgery will, and your gut here is kind of like proximity, right? Proximity problem. And so if these adhesions, they start to bind to all of the organs, they get stuck. And when things get stuck, they don't work as well. And then you start to lose your motor migrating complex, which is the motor motion that pushes bowel forward. And in SIBO, that motor migrating complex stops working. And that's when you can't propel the bacteria and the waste products in your gut forward, and then they sit there. And when they get to sit there long enough, they're going to start colonizing, and they can even migrate up into your small intestine, which isn't really where your bacteria is supposed to be. There's some bacteria that would be beneficial for them to be there. But the complexity comes when these bacteria, they migrate up into the small intestine. Well, we have protective mechanism for that. You have stomach acid and bile production. So in the stomach, we digest protein. And then once you digest the food in the stomach, it goes into the small intestine, and then bile gets released. Bile then neutralizes the stomach acid, but that combination is what keeps the environment in the small intestine relatively sterile. That's how we keep all the overgrowth at bay.
And bile helps break down the fat, right?
Fat, digestion, but it also helps release toxins that the liver have broken down. And then bile also prevent bacteria from overgrowing in the small intestine. So it has a lot of different function. But when a person has symptoms like belching, burping after eating, and bloating, those are all signs that you actually don't have stomach acid. Now, what is that? Well, if you have low stomach acid, you can have reflux. And people think, oh, reflux is an acid problem. Let me put you on some antacids. Well, that will further decline your stomach acid, which you already have low level of. And the mechanism is that in the stomach, if you have low stomach acid, there's a sphincter that connects your esophagus to the stomach. There's a valve. That valve doesn't close when there's not enough stomach acid. It closes when you have a lot of stomach acid. So because the valve doesn't close, this little acid that you do have regurge, and that's what causes reflux symptoms. But it's mistreated, and it's allopathic medicine, PPI, like omeprazole, Tums, and Peptides. All these medications actually worsen your stomach production of stomach acid. Now it's worsening the symptoms, and now you have more symptoms after you get treatment. And that's the complications that most people don't understand. When they get traditional treatment, it actually can worsen the SIBO.
Okay, so, and I think one of my issues maybe in the past was I didn't deal with the motility afterwards. I heard that that's maybe one of the biggest factors of a relapse of SIBO if you don't take. So I started taking, I just started taking some ginger root a few days ago to help with that. But I never had an issue being regular, so that wasn't I never really dealt with constipation or anything like that.
Yeah. You want to hear something more complicated?
Please.
So with SIBO,
I'm going to talk about your mom now.
With SIBO,
yeah,
there's 3 main types. There's a hydrogen gas type, there's a methane type, and then there's a hydrogen sulfide type. Hydrogen usually causes diarrhea. Methane usually causes constipation. Hydrogen sulfide is the more toxic gas of the 3, and they can cause both. But usually the hydrogen sulfide is really bad. You're very sensitive to food that has sulfur, which is broccoli, all the healthy vegetables. If you eat them and you get worse, you might have a sulfur problem too, right? But what if you get both? What if you have hydrogen and methane gas? They will cancel each other out, and so the diarrhea and the constipation may even present like you have normal bowel movement, but you actually have both. And then there's condition where you have overgrowth of Clostridium, which is a very specific bacteria in the gut that in general they're not bad. It's when they overgrow that they cause constipation. So you can have combination of different things going on in the gut that can present very benign, and you're like, oh, I don't have any bowel movement issue, but you may, because you got to look at the whole picture.
Okay.
Yeah.
Okay, so going back to the assessment, you would go over the medical history, symptoms, and then what? Testing after that?
So then once I see where your problem comes from, so your case is pretty straightforward. We just do a stool test. There's a lot of stool testing on the market. There's GI effects, GI map, and then recently, not a couple of years, there's a company that came out with this stool test called Gut Zoomer. I love this test. This test tests for inflammation in the gut. So a lot of tests, they test for infections, only a few organisms. This one tests for over almost 100 organisms, from bacteria, fungus, viruses, antibiotic resistance genes, small parasites, and then large parasites.
Okay.
There's no other panels that check the way they check it. And then most organisms, even when you test, they don't come up positive because they hide, and just because you have a bowel movement, that doesn't mean everything in your gut comes out. So what they test for is indirect markers that are inflammatory markers that are associated with ulcers, that are associated with parasites, yeast overgrowth, bacteria overgrowth. So you can look at how your immune system is responding versus just looking for organisms, which most of the time is false negative. Now you have the ability to look at your immune system response to the organisms that live in your gut. And then they also test to see, do you digest meat fiber, vegetable fiber, and fat? Are you absorbing everything? That will allow you to see if you have malabsorption issues and nutrient deficiency issues, right? And then you can also look at, so they just added a urine component where they're looking at neurotransmitters. So you can actually look at serotonin, GABA, histamine, all in one panel. So I don't really do a lot of SIBO breath test anymore because you can't really test for the whole terrain. So you really, when you deal with gut issues, you got to look at the whole terrain, not at just the problem, but how does that problem affect the whole terrain of your gut and then your whole body terrain as well.
Now, I've done a stool test a couple times, but for someone who's not familiar with this, can you fill them in, like what a stool test is?
So conventionally, the stool test, we test for eggs and parasites,
but I mean,
and
like,
bacteria infection. You just collect
how do you do it?
Oh, you mean like how you...
Yeah.
So usually they come in a kit, and they'll have like gloves. They have all these things that you do to collect the stool, and then you take they have a tube that you collect. Now you gotta collect different areas of the stool to really get a good sample. So you gotta poke in different places, and then you put it in the tube, and literally wrap it up and send it back to the lab. It's very
Mine, I had to
convenient
keep the little vials in my fridge for a couple days because you have to do over a 3-day period.
Well, you can. There are stool tests that are 3 days, but most of the tests I do is just one-time collection. But a 3-day would definitely give you more data, right?
Okay.
More collection means you test different timings, so it does help. But in general, you don't really need to.
Yeah. Well, that's good to know. Yeah. I don't have to be one of these
Probably
freaks.
not the part that most people rave about, but they do love the results, right? It's to see like what do you see, and what's amazing about this gut zoomer, they also test for autoimmunity. Are you reacting to gluten? So a lot of these tests, they don't have that component, which allows me to see, are you reacting to gluten? Do you have significant leaky gut? They'll test for leaky gut as well. And then they also test to see if you have short chain fatty acids. And you know, short chain fatty acids are good bacteria waste product. This is where, like, why we want probiotics and prebiotics is that we actually don't produce short chain fatty acids. Only bacteria, and only if you feed them the right food, then they produce these short chain fatty acids that will heal our gut lining, that will basically regulate our immune system to make it less reactive, and then it provides energy to the cells that live in the gut. So all of these components you don't find in other stool testing. That's why testing is really important. And so in your case, I would do that. I would also do an organic acid test for you because I suspect yeast. Most people, because of the antibiotic history for you, you have to make sure you rule out yeast. And I'm pretty sure you also have yeast. Just you had too many,
Well, I've never
more
had a
than
yeast
3.
infection, so.
You had, or
No,
you
I
did?
never had a yeast infection.
You don't have to have a yeast infection. And
I thought-
in men, it's
yeah.
actually more hidden than women.
Okay.
Because women will manifest yeast in their vaginal flora, but men, you don't have that. So you actually, it's harder to diagnose men who have yeast issue than women.
Okay. So you do these, and you mentioned one of the tests, it can reveal if you have leaky gut. What's the mechanism for that? Is that the short chain fatty acids?
No, it's going to be zonulin. So
Oh, okay.
zonulin is the protein. So there are cells in the gut called epithelial cells. They're bind together and they're hold together by these tight junctions. And zonulin is one of the protein that hold these
like a
tight
sticky
junctions
substance,
together.
right?
Yeah. So when these cells die, they release all the content inside the cell out. So when you know you have gut damage, if these proteins are being spilled out into your stool. So it's actually a very accurate way of measuring leaky gut.
And it was explained to me once that gluten mimics zonulin in the gut, and it disrupts, like gluten, even if you're not intolerant of gluten, it can disrupt the lining of the gut because of that.
So gluten has multiple ways of affecting our gut. One is that the gluten in our country, the wheat that we grow in our country, has been genetically modified to have higher level of biotoxin A. This biotoxin A is meant to resist pests. So pretty much any pest that eats the wheat, they die. So it's very effective. But at the same time, this biotoxin A is very toxic to us. It doesn't kill us because we're larger organisms, but it damages our cells. So when you consume gluten, it damages the cells in our gut, and that contributes to leaky gut.
Okay.
Okay, and then there are components in gluten itself that mimics other molecules in our body, and then that can cross-react, and then it can cause problem from molecular mimicry perspective.
Okay, so you run these tests. Let's say it comes back positive, leaky gut, SIBO, maybe yeast, parasites. What do we do now? Do I just go out into the desert and farewell?
Yeah.
What happens?
So typically, what you need to do first is stabilize the inflammatory response in the gut. So I usually spend between a month to 2 months just to work on the gut terrain. And the first step is to decrease the bacterial load and the yeast load, and then you focus on really just repairing the gut a little bit so that the gut is not the source of inflammation, like active inflammation 24/7. Once you've decreased the inflammatory response in the gut, then you can go in and treat parasites. So I treat in order, because if you don't focus on drainage of the gut first, which is having really good bowel movements 2 to 3, maybe even 4 times a day. So elimination is very important first to get that process going. Decrease inflammation, then you can treat parasites and the liver. Because the liver is very backed up when you have gut issues. So once you treat the gut, you can then drain the liver, and then you can drain the lymphatic system. And this is where, if you can understand this, you will be able to take care of yourself. Is that everything in our body, at the cellular level, at the tissue, and all of our organs, they all produce waste products. We produce a lot of waste product. The parasites, the viruses, the bacteria that live in us produce a lot of waste products.
So you need a binder,
You
right?
need to make sure that you are eliminating all the waste products. And how our body does that is that our lymphatic system, which are all your lymph nodes, it collects waste products from the tissue and the organs. And it runs through this point right here, 2 finger above the belly button. There's a cisterna chyli point. This is where it's like a big lymph tube, I would say. And it collects all the waste products and it dumps them into the liver. And then the liver process all of that waste products, break them down, make them water soluble so that you can eliminate them through the gut. 80%, I would say 15% go to the kidneys, and then 5% go to the lungs and the skin, because those are also detox organs. That's why if you start having skin issues like psoriasis, eczema, acne, it's actually because you're not draining your toxins well. So it always will come back to the gut. Because if you work on the gut, then the gut will drain, the liver will drain into the gut properly, and then the lymphatic system can drain into the liver and the gut properly. So it's that drainage pathway. It's kind of like a sink, right? If you overfill the sink and if it's not draining, you're gonna have overspill and it'll spill into your home. Same thing as waste products in our system. We will have backup toxins that will recirculate in our system. That's what causes systemic inflammation, systemic brain fog, fatigue, autoimmune disease. I mean, all of the manifestation will depend on your genetics. That's what determines what kind of diseases you get and what kind of dysfunction you get when you are exposed to environmental toxins and infections.
Okay.
Right? And then so that's why you want to make sure you drain your gut, your liver, and lymphatic system. If you can keep those 3 organ system work well, you pretty much have 80% of the work.
How do you drain it?
Diet. So you could use food as medicine. Right? So when you work with us, typically we walk you through the different food plans or different dietary changes because you want to educate, right? The first thing is to remove all the inflammatory foods. Second thing is adding in fiber, but it's not just, oh yeah, eat more fiber. It's the variety of fiber. It's variety of food, diversifying your food and eat according to the season and minimizing processed food, animal protein, but diversifying everything else.
Interesting.
So, and then there are very specific nutrients like, oh my gosh, I always chlorophyll, right? And then oh my gosh, I keep forgetting the name, but chlorophyll and things like moringa. Anything green usually are very good for detox. Any food that is red is usually good for circulation and focus, energy, right? And orange food are very much for energy production. So eat the rainbow of the color. That's really, and obviously it's a lot of legumes, right? And plant-based food and mushroom. Oh my goodness. Mushroom is really like so amazing. It's depressing when I go to see these conferences and I learn about plastic, microplastic, PFAS and everything, right? But what's even more amazing is that there are food that can help us break down these plastic.
Mushrooms do that?
Yeah, mushroom. What do you call? I eat this every single day. Oh my gosh. Oyster mushrooms.
Okay.
Oyster mushrooms have been proven to be able to break down plastic in us.
I gotta start eating some oyster mushrooms.
Yeah. Even white button mushroom, one serving per week can reduce a woman's risk of breast cancer by 35 to 40%. Wow. Just one serving a week. Yeah. It's really our immune system, right? Yeah.
Okay, so you drain everything.
Yep.
And then
you have to drain it in order. You can't just go straight to the liver. You can't go straight to lymphatics. You have to work on the gut, liver, lymphatics, organs and tissues, and then cellular detox. That's how you would drain and detox.
Okay. And then what comes after that in this?
Maintenance.
Maintenance, so.
Yeah. So pretty much if I work with you, like we get tests back, I'm like, okay, you have yeast, you have bacteria. We're going to spend some time working on treating those things, whatever we find. But I do treat parasites if I find that you would benefit from the parasitic cleanse as well. And most people, I can tell if they have a lot of parasitic problem from just their blood work. You could do a CBC but the thing is like just because it doesn't show up on your blood work, like your, let's say, so there's your CBC with differential is like your red blood cell count, your white blood cell count. Well, when you do a differential panel, you're going to see neutrophils, the percentage, and then lymphocytes. So neutrophils fight bacteria. Lymphocytes fight viruses. Eosinophils fight parasites. So if you can look at your blood work and see like, hey, you have a dominating bacterial like neutrophils percentage, like 60, 70%, then your body is telling us you're dealing with a bacterial problem. If your eosinophils is more than 3%, and basophil, which is the cell that go out and repair tissue that are damaged by parasite, if both of those are elevated, then you're going to have a parasitic problem. And then if your lymphocytes are high, then you have a viral problem.
Yeah, the idea that there are parasites and like worms inside me eating away and taking my nutrients it's gross, first of all. And then it's like, I want to fight these things. And ever since I started learning about this stuff, you should see my Instagram feed. It's like parasite cleanse.
Yes.
And then they show the stuff in the toilet. People have these massive things coming out of them. And it's like, oh my God, has that been happening to me that happened to you?
Oh yeah. My husband, he has so many parasites because he traveled to Asia multiple times and he just collected a lot of them. And when we did our parasite cleanse, he probably will beat pretty much all my patients. But I have 2 patients, literally for months. They pass parasites every day.
Oh, wow.
And even when I'm like, okay, we're ready to move on, still passing parasite. And these are really sick people. So the sicker you are, more than likely, the more toxic you are.
And are you doing the ivermectin and mebendazole, or are you doing wormwood, black walnut, clove?
I do more of herbal protocols. I only use ivermectin and mebendazole if the patient can't handle herbal protocols. Because the thing is this, you can go in and kill things off, but if you don't fix the terrain, if you don't give the body what it needs to repair the terrain, you're just killing things off, but your body is still damaged, right? So the work is in using protocols. It's not like, oh my gosh, you have to take so much. It's because they have different function, right? If you have leaky gut, you got to repair the leaky gut too. Just by killing things off don't automatically repair the gut lining.
When you
Right.
pass the parasites and you've seen it in the toilet,
Oh, yeah.
is it still moving or is
No,
it dead?
they're dead.
Oh.
I have seen parasite came out of someone's nose. That was live. I've seen
Sounds like Greg.
a parasite came out of someone's abdomen
What?
and someone's skin right here. Like they literally crawl out.
So they were tiny when they were like transported through the lymphatic system or whatever,
Yeah.
and then they
They
grew
actually
in there.
move around. They can move anywhere. Parasite, bacteria, they can move anywhere around our system, especially when you have leaky gut. All of our tissues are very fragile. They could migrate through our whole system. Now, there's a lot of parasites that you would get it infected in the gut, but once they lay eggs, they go somewhere else. And there are flukes, like liver flukes, huge problem in the Asian population. But liver flukes are actually small parasites. If they get big, they're like the size of the tip of your pinky or your finger. And they don't live in the gut, but they live in the liver. And those liver flukes, depending on what toxins you're exposed to, so there are cleaning chemicals that when you're exposed to enough, the flukes in the liver can migrate from the liver to the pancreas, all because you have maybe like benzene or there's some wood alcohol, like some cleaning alcohol that they use in industrial cleaning. Well, where would you get this? If you eat processed foods, just simple salad dressing. To make salad dressing, you know the whole process of what it has to go through. It's these huge machinery that grind things up, but imagine what it takes to clean these machines. When we get exposed to chemicals, it's the cleaning chemicals that are in these processed foods that we don't even think about. It's not what they put in the food, it's the whole process of processing the food that expose us to these hidden chemicals that then it dictates how the organisms that live in us and how well they thrive. Because a lot of, parasites, they're there for a reason. They're not there just because, to suck the life out of us, but they are actually, biodegraders. So they break things down, right? And they consume heavy metals. So parasites actually love heavy metals and they love like chemicals and things like that. So they feed on those things. So if you have an environment where there's so much of their food around, guess what? They're gonna thrive in our environment. That's why eating clean, that's why just simply by changing our diet helps with so many conditions, is because the organisms that live in us and the exposure that we get through food, by just eliminating, I'm not even talking about eliminating, just limiting makes a huge difference in our health. And that's because it's the load that we're dealing with. So if you cut off the source, you've done a lot of the work already.
Is there anything someone can do on a daily basis to minimize their effect or the effect of parasites, or to kind of fight them? I mean, I heard castor oil at night on your belly button, stuff like that. I've heard, obviously the herbal teas like the wormwood, black walnut, clove.
It's more prevention. There is nothing you could do to, well, let me say that. I shouldn't say there's nothing you can do. It's more like if you keep your toxic load, let's say at this level, imagine your body's like a bucket, right? And as this bucket fills up with toxins, stress, nutrient deficiency, hormone deficiency, right? Sleep deficiency, all of those things are factors that will affect our health too. So as you fill up the bucket with poor lifestyle choices and processed foods and eating from plastic containers, like styrofoams and things like that, or eating a lot of sugar, all of those things will build up your toxic bucket to where you can overfill it. So the goal is to lower the bucket. So all of the lifestyle component that minimizes exposure is going to be key. So what that looks like is, I don't think organic food solve the problem, but it's definitely cut your exposure by a significant amount. So organic produce as much as you can, right? Honestly, you can go into like meat. When you eat meat, you gotta really know where your meat come from.
Yeah.
I would never buy Publix or, like store, like grocery store produce. Not produce, I'm sorry, meat, because of how they process it. It's not just how they're grown, but it's how they're chilled.
Yeah.
What goes on into that whole process of getting a live bird into the supermarket.
And the whole factory farming. And
most of that I would avoid. So I only buy my meat from a regenerative farm. And then there's a component of, I'm going to tell you everything I know because I'm like, there's so much to talk about. But even like animals, when you kill them, it's very stressful. They release cortisol. They get fearful. They get stressed out. Guess what? And you kill an animal and then you eat their meat, guess what are you consuming? Everything that they were experiencing. You can actually get their trauma. You can consume their trauma.
But I thought that's how the elites stay young, with the adrenochrome.
I know, isn't that crazy?
You would think it would work in our favor.
I know, right? But it doesn't. So that's why, kosher and halal meat, in general, I would prefer that if that was an option. But to me, regenerative farm, pasture raised, most of the meat we have nowadays, they're not 100%. It cannot be, because mainly in the winter, there's always going to be substitution. It's just a matter of how much. But if you can do 80%, that's going to be my rule, is 80-20 rule, is 80% of the time, you keep it as clean as you can and just minimizing exposure to chemicals and plastic as much as you can. So, basic things, glass containers, stainless steel, and then cookware. Got to make sure your cookware is clean. And then if you do have those Teflon, just make sure you use a wooden tool instead of a metal tool to avoid the interaction, because metal on metal, they will always break each other, right? And they will always release chemicals into your food. So
I stopped
basic
using
things
Teflon
like that.
a long time ago. I'm just cast iron and stainless. That's all I do.
Yep, that's pretty much, you got to go that route. And then simple things like, I don't eat anything that comes out of a box. And if I do, it probably only have about 5, maybe 6 ingredients. Anything more than that, anything that I can see as a filler or preservative, I just don't. I mean, sometimes you can, but that's the load, right? It's like you're out, you're traveling, a little bit would be okay. But I'm very strict in that because I know the effect, right? And then as food goes, I just try to do 70% vegetables and fruits, and then a little bit of fats, and then your protein should be a clean source of protein. I think we're over consuming protein. There's a lot of health issues that come with having too much protein. So,
It's interesting you mentioned that, because I mentioned before we started rolling, I interviewed a carnivore who's been a carnivore for 40 years. The guy has no health problems. He looks 20 years younger. And then there's also like a movement now of the carnivore diet, and people apparently using it to cure like crippling autoimmune problems that's been their whole lives.
Yes.
It kind of goes against all the conventional wisdom that we've been taught, right? Like, eat the rainbow and get your phytonutrients, and don't have too much fat and cholesterol. But the people that have been doing it seem to be having amazing results. What do you think?
This is where I love science. This is where I think humans, like who we are so highly intelligent. And this is also where you got to be able to discern. Some people don't do very well on a carnivore diet. I've tried it. I am not one of those people. Some people, because of their genetic makeup, they do very well on the carnivore diet. There's a couple of things. I think one is that you've heard of the plant paradox.
Sounds familiar.
There's a book called The Plant Paradox.
Because they're like poisonous.
Yeah, so plants, to protect themselves, they have, chemicals and compounds that basically kill off animals. Because we're so complex, we're not going to be killed from these plant, toxins, but we're affected by them. So some people, they're going to be more vulnerable to those toxins that come from plants. the thing with carnivore diet is if you really look at it, there's a couple of explanations I've seen is that you remove grain, you remove all of the plant component. So for someone who, especially if you were talking about autoimmune disease, there's a lot of things in plants that can trigger your immune system to respond and cause inflammation. And then, but the meat, it doesn't do that because it's a lot simpler in the makeup than plants are, right? So that's one. The other is that when you remove grains and plant-based food, there's a lot of mold and there's a lot of environmental toxins in these foods as well. So some people I would say have found evidence that because you're simply just decreasing the exposure of mold and the chemicals and the toxins found in the plant-based food, you in general would do better.
And I wonder how much of it is like just getting rid of so much of the sugar and the glucose, it seems like a lot of people, if you look at their plates or their shopping carts, it's a lot of carbohydrates and just turns into sugar in your body. And we know that sugar feeds into these problems like the SIBO and inflammation and diabetes, obviously. So I wonder if that's a factor as well.
It definitely is. And that's the thing, right? We don't really have all the information and the know, like we don't really know. And I think all the research we do, see, this is the limitations as humans we need to understand. That when we research something, we can only understand part of it. We could never fully get the whole picture. And so we can never say anything definitively, but what I see is that it's different for everyone. So I have had a patient who's on the carnivore diet to the T, and he feels great, looks great, but his blood work, multiple autoimmune disease, multiple like clotting factors, like a lot of health issues that he's not feeling.
That's just the vaccine.
But I was debating whether I want to go there or not, but maybe for another conversation.
Let's ruin both of our careers at once.
I know. I was like, but now I think it's good to just have an open dialogue about it, and we could have different opinions about it, but let's keep looking because I don't think there's anything that's truly definitive. And so I think we need to be open to receiving new information, but also keeping in mind like there are foundational things that we want to kind of like understand, like carnivore diet. Just to me, if I just look through my critical thinking, right, I'm missing so many antioxidants. But obviously, if I'm having health issues and I'm eliminating these things and they're working, it's because there are so many co-founding factors. And I believe environmental toxins have a lot to do with what's in the plant-based food. And I think by eliminating that, they eliminated their toxic exposure to, and lowering that load for their body. So in general, they will feel better. And in general, if you're gonna be on a carnivore diet, I don't think you're gonna eat like that much meat, like you have to have some kind of moderation in your portion. And I think by just eating moderation alone, and the part I'm trying to see if I should explain is that our immune system is so complex in how it responds to environmental toxins and plant-based, chemicals and compounds that in general it's works. Some would work great for you, but the plant-based, some of the same thing may not work for me. So it's our individual biochemical makeup is really what you want to, I guess, dig into and know for you to really be able to say what would be the best diet for me.
And maybe one diet's good for you temporarily while you're dealing with one thing, and then once you figure everything out.
Yes.
Like for example, I for the last couple of days I tried the carnivore thing, and I was surprised at the energy that I had. And the last meal that I had before I tried it was fish and rice, a big thing of rice on the plate, which, like I said, turns to sugar in your body. And I felt sleepy after I ate it. And then the next couple meals were carnivore, just meat and eggs, and no problem. Satiating, was tasty. I thought I'd have to have more variety, but it's like, fat and salt and everything and protein. It's like it'll fill you up and it'll taste good. And And yeah, I was able to operate at a
Yeah.
higher RPM, I think.
I think so. With that is that, you know how I said the stomach is responsible for digesting protein with the stomach acid? Well, carbs require different enzymes to break down carbs. So when you eat some, like a combination of carbs and protein, your body's actually confused. It's like, well, which one should I digest? I'm going to digest the meat and the carbs. So now you actually are you are digesting both of them poorly. So then you would you would spend more time trying to digest that, and that's why the sluggishness. Okay.
I think the Gracie family had a diet. The Gracies, like the jiu-jitsu family, had a diet where they didn't have chicken and rice together or something like that for that reason.
So a lot of there's actually a few people and few cultures that they don't combine carbs and meat. And you may have heard of the glucose goddess.
No.
She's a scientist where she studied the effect of food on blood sugar, and her research was so amazing to find that if you eat a meal and you separate the meal by eating fiber, carb first, like complex carbs first, then your fat and protein, and then your simple carbs, you will blunt your blood sugar getting higher and insulin getting higher in that meal by 30 to 50%.
That's incredible. And that sounds like a traditional appetizer with the carbs, protein entree, and then a dessert, simple carbohydrate.
Right. Yeah. So we actually, I think, you know, if you look back, ancient traditions of how we do things, how we eat, even from Asian traditions to European traditions, they actually figured out how to eat. It's the modern lifestyle, which is eating everything. And we actually have way too much food nowadays. And we're mixing foods that historically aren't really meant to be mixed together. And food chemistry matter. How you can have, you know, let's say you can have one herb and it can interact with another vegetable that you eat, right? So interactions between compounds of plant-based food matter too. So that's why if you can eat, it's not as fun, because if you break down food and you eat them in order like that, you don't get that mixture of different texture. So most people don't really prefer that, but really if you eat like that, it's actually easier on your digestion. And you don't have the side effects of blood sugar issues and insulin resistance issue by just simply changing the order in which how you eat food.
Wow. You know, it kind of all goes back to the basics.
It really is.
Yeah.
Really is. And, you know, I think it's like simply is eat in moderation. Everything in moderation, you know, and learn to tune into your body. Like if you have a pain somewhere, don't ignore it. You know, like, and this is how it's our brain is so amazing. It's that if you just ask yourself, hey, what does that mean? What does that pain mean? I'm telling you, within the next 24 hours, something will come up. Your body will tell you. So one of the things I'm really putting together for my patient is a retreat to teach people how to really read signs and symptoms that come up, and then really learn how to tune into our body, because we are not taught that, you know, growing up. But like a long time ago, we actually knew, like people knew what's going on with their body. We just got away from that because of all the convenience, and just like the culture has shifted, we don't have that, you know, that tradition of passing down stories and, you know, like those stories and like ancient wisdom that are being passed down. Like we don't take that seriously anymore.
Any signals our body is telling us, we're numbing them or distracting ourselves or taking a pill to shut
I
it
have
up.
pain in my knee. I'll take an Advil. And I think culturally we've been conditioned to do that, and we thought that that's normal. We don't know any other way, right? But now it's like, no, just, you know, I think, you know, it's hard to say, well, do something different, but there's a lot of research, there's a lot, and then knowing who to trust. That's why what you do, I appreciate it, because I think we just need to have more dialogues and conversation so people can hear it and people can start to discern it for themselves. But I think critical thinking, we're losing that. Kids don't even know how to read anymore, and they don't know how to comprehend what they read. So imagine like a whole generation, like all of us are being affected by the modern life and the lifestyle that we've taken on. So it's really just going back to the basic, teaching people how to just like stop, don't cover things up, don't, just because you feel discomfort, be with the discomfort and, like investigate versus like accepting that, oh, it's just pain, oh, it's just aging. Aging do not cause diseases. Toxic burden does, right? Deficiencies do. And hormone imbalances doesn't just happen because you get older. It happens because there's something else interfering with your body system, communicating with each other. And as human beings, we are run by hormones. And if your hormones are off, you got to look at what drove the hormones to be off, not just go straight to, oh, I have low estrogen, I have low testosterone, let me just get on testosterone. Well, do you know why we are having lower testosterone in men? Atrazine, second most sprayed pesticide in the world, proven to turn frogs, male frogs, into
gay. Yeah. Alex Jones talked about that
Yes.
back in the day.
Yes. And then the doctor who was researching this, he was being paid off. He said, the company who told him to do the research, they said, hey, we'll pay you if you don't show the research, like don't show the results. And he was like, no, this is solve the implications, right? And like we lost 75% of the world frog population because of all the atrazine that is in the environment. Well, guess what? It's not just frogs. It's other, population, animal population. We're seeing decline across all animals. And there's a paper I saw, basically by 2050, we would lose pretty much 98% of ocean life because of how toxic our ocean is.
Yeah.
And fish, very healthy, but now we can't even eat them more than once a week because of how toxic the fish is. And most fish now that you get are farmed raised fish, which are fed the same thing the chickens are fed.
Yep.
And so you're eating the same food thinking that, oh, I'm getting fish, it's healthy. It's not.
I heard the fish are all gay too.
Yep. And I mean, I don't know if you're paying attention, but I'm seeing that we are seeing more gay in humans.
Well, there's the trans explosion thing.
It's like, you could say it's part of that is culture and we're more accepting, but really, is it? Or is it there is something else driving that? And he Dr. Tyrone, he was the one that exposed this. And he did not accept their bribe, and he actually said no, and they actually went after his family. They threatened to, hurt his wife and his daughter. So, and then he went public with it because he's not going to turn and hide this. And that's how we knew atrazine and all these pesticides is causing hormonal disruption. And that's why you can see all the endocrine disruptors, right? When they're in our system, they hijack our hormone system. And because your body thinks that, oh, you have a lot of testosterone, which are molecules that shape like testosterone. They bind to your cell like testosterone, but they're not testosterone. And then, but the thing is, it gives off the signal to your brain that you have a lot of testosterone. Now your brain is like, oh, you don't need testosterone. Let me shut down the production of testosterone. And that's why young men are now having very low level of testosterone, is because, well, part of that is
50% since the 70s, right?
Yeah, and fertility rate too. I mean, we thought it was an Asian country problem. We're seeing a decline in the US as well, and all these IVF clinics popping up. It's not a coincidence. There's a pattern, there's a common denominator, and that's all the environmental toxins that we're being exposed to. And what are we doing with the kids that are having low testosterone? We're putting them on testosterone at teenage years, 20s. And guess what? If you put yourself on testosterone at that young age, you will not be able to reproduce. You will shut down your own body's ability to produce testosterone. And that's how, our fertility rate is going to continue to be affected.
Okay. That's okay. We'll just wrap up on the other two cameras. I can tell you're really passionate about this. I love it. And I'm so glad I met you. Can you tell people where they can find you? Do you have any socials? I know I mentioned we're here in Alpharetta, Georgia.
Yes. I'm so horrible at my social media stuff, but you can find us at consciousmed.co. That's our website. I try to make my website very informative, so my IT team is like, you cannot put all this information on your website. I was like, people need to know. So I'm very much like, I want to educate, so you can learn a lot on our website. If you're interested in speaking to me just to see how we can help you with whatever health condition you're dealing with, we do offer a complimentary 15-minute phone consultation that you can book on my website, or you can call my team at 678-261-7879. I have an amazing virtual assistant team that's going to help you. Just more information about what we do and scheduling the 15-minute call with us. And as you can see, I do regenerative medicine, so joint pain. So I treat a lot of osteoarthritis and shoulder arthritis with hyaluronic acid injections and PRP. These are things I would love to talk to you more about.
I actually want to do an interview for PRP.
But peptides, I love peptides. I think peptides is kind of like the new up and coming revolution that we're going to have. And if you look at the data and the research they have in Russia and Europe, this is what they use to get rid of common illnesses every day. It's just using peptides, and they're very effective. And these countries, they're poor. Well, I shouldn't say they're poor, but they have to be really effective at managing their population health using, not having access to a lot of the medication we have here. And what they use is herbs and peptides, and they work.
And I know that there's a controversy around peptides, BPC 157. I've heard good things about, but I understand it's not legal technically, or they haven't approved it. And
there's a lot of committees that are going through that right now, and there's a couple of changes that happened since April that it is on the approved list right now. They were taken off, but my take on it is anything that works will have a lot of problem in this country because it actually will get you better. Just like Parasite. You know, Parasite was not taught in medical school, except for like if you go to Asia, Africa, then you probably would have parasitic exposure. But we live on Earth. Parasites are everywhere. But imagine the implications of, hey, I can treat your chronic diseases by treating parasites and then everything clears. Do you need medication anymore? Do you need the healthcare system anymore?
Yeah, exactly.
I don't know. That's
it's big business. They're taking them, they want people sick, make a lot of money. Don't take that horse medicine, as they say.
I know, and then now it's like everywhere. Anti-cancer effect.
Yeah.
All of these amazing, effect. Now, obviously, I think we have to be careful with these medications, but at the same time, we have to really see it for what it is too, right? And be able to be open to use it. And this is where I think if I don't speak out, the freedom that I love from this country will be gone. I think we're getting to that place where what we value every day, what we value as Americans, we're losing that. And so much to say about that, but
I know I could talk to you for hours. This is so cool.
Yes.
Well, thanks again for doing this.
You're welcome. My pleasure.
I see you have a great practice here, and hopefully we can work together. And I think this video will hopefully open the eyes of some people and educate some, and maybe they can take their health in their own hands with some guidance as well.
Yes, that's what I hope for, is that we all know that there's options. Because I went through my own health issues, and I wish I had known about functional medicine. And, it's a long journey for me, but I know that, people who are looking, who are searching for something different, you will find it. Just keep looking.
Dr. Truc, thank you very much.
You're welcome. My pleasure.